Picture this, a government shutdown dragging on, leaving millions of everyday Americans scrambling without paychecks, while politicians from both sides dig in over promises that feel as flimsy as a house of cards. It's a tense standoff over healthcare, and it's got everyone talking. But is it worth the cost? Stick around, because this is just the tip of the iceberg in a political drama that's highlighting deep divides in Washington. In a surprising turn, the U.S. Senate's latest attempt to restart the government hit another roadblock on Thursday, marking the 10th failure in a row. The snag? Key progressive lawmakers in Congress turned down Republican assurances that they'd tackle healthcare subsidies once funding was restored. For beginners wondering what this means, a government shutdown is basically a temporary halt to non-essential federal services, like paying workers or processing loans, all because Congress can't agree on a budget. It's like hitting pause on parts of the country, and this one has been going on for weeks, affecting real people in tough ways. The Senate's vote on a short-term Republican funding bill fell short, garnering only 51 votes, not enough to pass. But there's a glimmer of hope. A separate vote on Pentagon funding later that day could kickstart full military operations and stop the delays in troops' paychecks. After these votes, lawmakers plan to head out of Washington for the weekend, which pretty much ensures the shutdown will stretch at least until Monday. It's frustrating, right? And this is the part most people miss. These delays aren't just about politics. They're impacting national security and everyday lives. Senate Majority Leader John Thune, https://John-Thune, laid out his strongest proposal yet on Thursday morning, chatting with MSNBC, https://www.msnbc/news/Thune-MSNBC offered Democrats-vote Obamacare subsidies, RCNA 237914, and pledging to Democrats. /MSNBC.com/Democrats that he'd secure a vote on extending Affordable Care Act by a set deadline if they agreed to fund the government. To clarify for those new to this, the Affordable Care Act, often called Obamacare, is a major law aimed at making health insurance more accessible and affordable for Americans. Thune emphasized, at some point, Democrats have to take yes for an answer, urging them to move forward. But here's where it gets controversial. Just the night before, during a lengthy 90-minute CNN town hall, https://www.cnn.com/politics/Sanders/AOC takeaways/NN town hall/theguardian.com/US News/Alexandria Ocasio-Cortez shot down similar offers. They insisted on solid legislation becoming law before they'd support reopening, not just verbal commitments. I don't accept IOUs. I don't accept pinky promises. That's not the business that I'm in, Ocasio-Cortez declared to the audience. When questioned about whether a pledge from President Trump would suffice, Sanders responded sarcastically, "Oh yeah, no doubt, because the president is a very honest man." To put this in perspective, this skepticism stems from past experiences where promises led to nothing, making progressives wary of empty words. The New York Congresswoman and Vermont Senator also dismissed short-term solutions as mere stalling tactics to avoid tough decisions before the upcoming midterm elections. What we will not accept is for the ACA premiums to skyrocket on the American people, Ocasio-Cortez stressed, pointing out how this could burden families already struggling. Meanwhile, over in the House of Representatives, Speaker Mike Johnson, https://theguardian.com/Mike Johnson, has kept the chamber on hiatus for 4 straight weeks following the passage of their funding bill. Republican leaders claim this tactic keeps the pressure on Senate Democrats, arguing that reconvening would ease the standoff. Johnson and Democratic Minority Leader Hakeem Jeffries have been exchanging sharp words for weeks, but they've now committed to a televised debate on C-SPAN, https://politico.com/live updates/Mike Johnson, Hakeem Jeffries, C-SPAN debate -00912. Although no date is locked in yet, it's a classic political chess game. But is keeping the House silent really the best way to resolve things? Or is it just prolonging the agony? Thune expressed willingness to back extending healthcare subsidies, but only with tweaks like income limits, and he sidestepped committing to a full one-year extension that experts estimate could run about $35 billion annually, based on a CBO report. www.cbo.gov/systemfiles/2025-0-11-61734. And finally, moving on, he also admitted he couldn't promise results and didn't rule out the shutdown dragging on until Thanksgiving, over a month from now. I hope it doesn't last through Thanksgiving, he shared, adding a touch of realism to the uncertainty. This deadlock has hit federal workers hard, leaving them unpaid for weeks with no resolution in sight, as detailed in this Guardian article, https://www.theguardian.com/US News/2025/Octa15, Senate vote failure. During the CNN town hall, one worker with 4 kids voiced his fear. How am I supposed to feed my family? Another shared how her housing was jeopardized because the shutdown froze her government-backed loan. These are the human stories behind the headlines, showing how policy battles ripple out to affect real lives, like delaying essential support that people rely on. Ocasio-Cortez aimed to comfort them while standing her ground. My hope is that we're ready to resolve this as quickly as possible. It's a balancing act, empathy for the impacted folks versus unwavering principles on healthcare. So, what's your take? Are progressives like Sanders and AOC justified in demanding concrete action instead of relying on promises, or should they prioritize ending the shutdown to help those suffering? Some might argue that holding out could lead to bigger reforms, while others see it as stubbornness that's hurting innocent people. Is this a noble stand or a risky gamble? We'd love to hear your thoughts. Agree or disagree? Drop a comment below and let's discuss.